And now I'm really pleased we're going to move on to our staff story, and we have Sadie Milner with us today. Welcome, Sadie. Good to have you with us. And Hilary, are you going to do a little introduction before we pass on to Sadie?
Thanks, I will do. Thank you, Caroline.
Thanks, Hilary.
Yes, welcome, Sadie. Sadie's here to do the staff story around patient safety in the Trust. This is at the request of the Quality Committee. We had quite a few papers at the November Quality Committee around patient safety, and the committee wanted something at the board around a staff story, really, that describes patient safety in the Trust. So Sadie got the job ticket for her sins, but I know she's really looking forward to speaking to us all this morning about her role at the Trust. So without any further ado, I'm going to hand over to Sadie. Welcome, Sadie.
Lovely. Thank you, Hilary. Thank you, Chair, and hello to everybody. Nice to see you all. So I was invited to come along and give my staff story a couple of months ago, and I've given this quite some considerable thought since. I thought about the different ways in which I could present this. I didn't really want to do a formal presentation, but I have spent some time actually writing my story. So if you don't mind, I'd like to read that to you. So it is a little bit scripted, but I just wanted to make sure that I covered all the points. I've got quite a lot to say. I'm very passionate about what I do. So I hope you enjoy listening to it. So I am Sadie Milner. I'm the Quality Standards Practice Development Nurse working in the Nursing Directorates in the Quality Governance and Patient Safety team. So whilst preparing for today and thinking about my journey within patient safety, it's been a real opportunity for me to reflect with quite a lot of pride, really, as I celebrate 25 continuing service within the NHS. So my journey began back in 1994 as a student nurse at the Humberside College of Health, and it was part of what was then the new Project 2000. I lived in the nursing accommodation in the grounds of Delapole Hospital, Coniston House, which is now our Trust headquarters. So when I came back to work for Humber and began working from Trust HQ, it did feel very much like I'd come home. So I qualified as a registered nurse in March 1997 and started my first post as a D-grade staff nurse working on Harvey Ward at Princess Royal Hospital in Hull. I'd enjoyed 2 placements there as a student nurse, and it was this early positive learning experience that led me to spend the next 20 years working for what is now Hull University Teaching Hospitals, where I specialised in oncology and haematology. So throughout my years as a registered nurse, patient safety has always been very much at the heart of everything I do. So, for example, when I was a chemotherapy nurse working in a wet nurse-led clinic, I would ensure patient-centred care was safely delivered against national treatment protocols, responding quickly to adverse incidents. As a research nurse, often delivering quite novel agents, I would ensure patients were closely monitored for immediate, short-term and longer-term side effects. As a transplant specialist nurse, caring for patients who, due to high-dose chemotherapy, they were at considerable risk of infection, neutropenic sepsis, and poor nutritional status. And then my last post at Hull was as an acute oncology nurse practitioner, where I had to ensure the timely and accurate assessment of patients presenting with treatment side effects and oncological emergencies, and had to be able to recognise and respond to sometimes very subtle changes in clinical presentation. So working within oncology and haematology, I was really privileged to be able to support and care for patients at their most vulnerable, whether that be during active or palliative treatment, during periods of remission, and often at end of life. And I'm sure all of you will agree, my nursing, medical and allied health professional colleagues, that patient safety really is the bedrock, no matter what your specialty. So during my time at Huff, I was really lucky to be supported to complete my specialist degree in cancer care. And then I went on to successfully complete my MSc in leadership and health and social care. And after completing my master's in 2016, I recognised I'd gained some additional skills and knowledge, which would enable me to influence patient safety in a much broader sense. And I was keen to take on a more senior leadership role, and that's what led me to Humber. I joined the Quality Governance and Patient Safety team back in 2017 as the Patient Safety Lead, which was a new role back then. Due to my experience from 20 years in the acute services as a registered nurse, I was very much able to bring my physical health knowledge and clinical skills to the table, instrumental in guiding the physical health agenda here at Humber ever since. I'm the Deputy Chair of the Physical Health and Medical Devices Group, which is a subgroup of QPAS. Physical Health and Medical Devices Group are responsible for ensuring safe systems and processes are in place in relation to physical health care. We oversee the review of clinical policies and approve clinical procedures, protocols and guidelines, ensuring they are based on current best practice. We're also responsible for overseeing the procurement and approval of medical devices and the implementation of actions in response to national patient safety alerts, medical device alerts and field safety notices. I've supported and promoted the work of the Patient Safety Collaborative on the deteriorating patient workstream, sharing Humber's experience of the rollout of News 2 with regional colleagues. Humber was a very early adopter of the News 2 tool outside the acute sector and one of the first multi-specialty organisations to fully embed the use of this national early warning score. I'm incredibly proud of the work I've led in relation to the Trust Zero events. As part of Humber's continued drive to minimise patient harm in line with the Trust's patient safety strategy, focus is given to a number of key performance indicators on areas of potential harm. These indicators have been called zero events as they should never occur within our Trust. Zero events are determined by our Trust and arise from a result of a cluster of incidents or emerging themes from reviews or investigations. They can also be driven by national guidance or findings from clinical audits. I'm particularly proud of the work in relation to reducing avoidable harm relating to pressure ulcers, deteriorating patients and falls prevention. I've supported and led on numerous serious incident investigations and SEAs, initially as a support investigator and then following a period of training, I became a lead investigator and I'm now an SI buddy supporting others. In my role as Quality Standard Practice Development Nurse, I contribute and lead on many of the same work streams. However, in addition, I've added clinical policy management, clinical audits, peer reviews, implementation of quality standards and practice development to my key responsibilities, all of which positively impact patient safety across the organisation. I actively contribute to the key deliverables of QPAS and the Audit and Effectiveness Group, providing record-keeping audits and zero events. So one of my most memorable times with Humber, and one of the things I'm most proud of, has to be working alongside my mental health colleagues at Millview Court, leading the Rapid Response COVID team, supporting the development of the COVID pathway, developing and working at pace to produce staff through procedures reflecting national standards around the recognition and escalation of deteriorating patients. This was already well embedded. I'm particularly proud to have been there at the conception of the corporate safety huddle. Initially, it was just a few of us tucked away in a back office, but the huddle is now responsible for reviewing all patient safety incidents reported in the previous 24-hour period and ensures that the initial patient safety concerns have been adequately addressed, that the correct level of harm has been attributed, that duty of candour has been carried out, and that any potential omissions or lapses in care are swiftly and appropriately reviewed and escalated. Safety huddle, it's gone from strength to strength, and now representation and engagement from across the organisation, reviewing all our patient incidents daily, Monday to We actively encourage participation from across our services and divisions, and this also now includes our students. It promotes multidisciplinary working. It's an open and safe space to ask questions, to raise professional curiosity and give professional challenge. I believe the huddle has been pivotal in us understanding as an organisation many of our patient safety risks, and using this insight has given us the ability to proactively drive improvement and reduce avoidable harm, and this is something I am and we are as a team very proud of. Due to the success of the corporate safety huddle, the divisions have adopted similar models and all divisions now have safety huddles. So when thinking about what's been most challenging, and I'm sure you'll all agree the past 2 years has certainly been the most challenging in terms of anticipating working through and living through a pandemic. But for as many challenges as it has presented us with, it has also brought about some real positive change. For me personally, working from home was challenging, but it's reaped many rewards. I feel better connected to my colleagues across all the divisions and services through MS Teams. I'm able to work much more collaboratively and engage with many more people. Whilst a large proportion of my working week is working from home, I still have the opportunity to directly engage with my colleagues face to face. I enjoy undertaking peer reviews, which means I get to visit clinical teams and talk to staff and service users about their experiences and can share and celebrate good practice. I'm looking forward to growing and learning with my nursing colleagues across the organisation as we take forward the newly established Professional Nurses Forum. I'm looking forward to working with my colleagues in the patient safety team as we co-produce the new patient safety strategy with our stakeholders. I'm looking forward to the rollout of the new patient safety incident response framework as we continue to embed a safety culture where staff feel psychologically safe to have open and honest conversations and where our systems and processes support us in the delivery of safe care. My role in patient safety has changed significantly over the past 5 years. Initially, it felt very transactional in terms of reviewing incidents when things went wrong and often felt rather reactionary. There was very much more a top-down approach, whereas now there's a real sense of engagement, distributed leadership, with much more effective communication and cooperation, working with and alongside our colleagues to share learning and embed change. I'm really grateful for the opportunity that Humber has given me over the past 5 years. I believe my skills and strengths and attributes are recognised, and through this I've had the opportunity to shape my role. I was part of a team 5 years ago, but now I lead a small team of clinical and non-clinical staff, and our team continues to grow and evolve. I am lucky that I work with an amazing group of people, and I genuinely do feel very supported by my senior leadership team and my Executive Director of Nursing. I'm really passionate about my role in patient safety and the measurable positive impact it has. I would never have imagined being in such a role when I started my career 25 years ago. Nursing for me has been an incredible journey and has presented me with so many opportunities. Thank you.
Thanks very much, Sadie, for sharing your story with us today and giving us a bit more insight into your work and how it sort of cascades throughout the whole organisation. So we'll have some questions, I'm sure some comments from some of our colleagues, but thank you very much. Mike.
Sadie, wow, thanks. That was really inspirational. Thanks so much for the preparation that you put in. You said it was scripted, and it was, but it covered so many points. And how many times have we done a little presentation or we're going to say something, and then you get to your front door at night and think, oh, I've forgotten about such and such. So you've given us loads and loads of things that you're proud of, which is excellent, and you should be proud. You've given us lots and lots about work in progress, but what is it that makes you lay awake at night and worry about?
Thank you for that question. Right, okay, so if I'm brutally honest, I'll say probably nothing keeps me awake at night, and that's not a bad thing, really. I am assured that we've got really good systems in process. We have a really good reporting culture. We're not an outlier, but we certainly have that culture where we report our incidents and generally low harm incidents, and we're getting very good at reporting our near misses as well. I think we've got really good systems in place for understanding our risk, for escalating our risk, and certainly Hilary and John's door are always very much open to me. So I don't lay awake in that sense at all. I do have things that concern me, and I think they're the things that concern most of us in terms of patient safety around workforce moving forward. That's obviously something that the Trust is giving a lot of consideration to at the moment. But yeah, so that would be my answer. I woke up quite early this morning, but I think that was because anticipation of coming and speaking to you today, but certainly not sleepless nights.
Thanks, Sadie.
Good to hear, Sadie. I've got Dean and Stuart next, and then Dean.
Hi, morning, Sadie. I'm glad to hear you sleep well. That's very good to hear. I was really intrigued in your kind of life story about your recent reflections on the benefits of that enforced remote working has brought. And I wonder if you could just tell me a bit more about your reflections on how the fact that you're not seeing people kind of physically is nevertheless kind of compensated by able to talk to them kind of online and on screen and so forth. And just tell me about how you think that trend is. Do you think it's a permanent feature? Is it something that will eventually wane, or what? What's your thinking?
I think when it became very apparent that this would be a longer term, hybrid working, I did struggle with that a little bit, because I am a people person. I like contact with people. We all do. We all struggled during lockdown, didn't we, with the enforced separation from people. So to think of that as a long-term sort of moving forward, that was quite a struggle to start off with. But I mean, the trust has been really good in providing us with what we need, the IT. We've really ramped all that up, haven't we? I'm in daily contact with my team. We speak regularly. We meet up at trust headquarters. We make good use of the space there when we need to, and we meet socially up at the Costa Coffee up at Willoughby. So we do keep very connected. And like I say, before all of this, when we had to have meetings, we were not able to connect with our colleagues up at Whitby and Malton quite as easily. So it really has, it's changed that for the better. Moving forward, I'll be sorry to see trust headquarters go. That again will be a new way of working when we go over to the new, well, it's not trust headquarters, is it? We're not calling it that, but so yeah, we'll see how that goes, won't we? We'll see how that goes. It's strange for a clinician, I suppose, somebody who's spent 20 years with that face-to-face contact with your patients and your service users and your colleagues, but it's got a lot of personal advantages for me as well. I'm a mum, I've got a young boy, I can do the school run, I'm always on hand, so I don't have the commute to work anymore, saving money on petrol. So there's lots of little things that make it positive, and it's about drawing on the positives and not.
That's really interesting, and I guess that's very interesting. I guess the art, isn't it, of modern living and working is to make the best of the technology without jettisoning all the things that are important about face-to-face contact and that human interaction. So thank you for that.
Can I just, before I bring Francis, just check something with you, Sadie? But seeing people in person is still important, and I just wanted to ask about how often you manage to get out and actually see patients or hear from their families, because they're part of the patient safety aspect of all this, not just staff.
Very much so. So at the moment, I get quite involved in I really enjoy the peer review process, because that allows me to do that. But we've got the option to do that both remotely and face to face. So it depends what the service is, where it is, how easy it is to get to, I suppose. But also we're still having to consider social distancing in some respects, aren't we? So it does still impact on my ability to get out. Like I say, majority of my working week is working from home. I do try and make sure that we meet as a team frequently. So I think my avenue into clinical teams is through when we're doing work around competency assessments, when we're doing work around if there's been an incident, if I'm leading on an investigation, obviously I go and meet the team and the staff face to face and speak to patients that way. But yeah, the peer review stuff is my avenue at the moment, very much so.
Okay, thanks very much. Francis.
Thanks. Hi, Sadie. I've had most of the question answered, because it was the same as Stuart and Caroline. But the addition to that was, do you think the new way of working has created any new safety issues as a result of this kind of hybrid working, and that you needed to tackle and need to think about going forward?
Again, something I think we're all very aware of is the element around closed cultures, isn't it? And I think that was potentially a patient safety concern, particularly when we were very much in lockdown and we were not able to go out to clinical areas quite as much. That's probably lessened considerably now, but I do think it's quite important, isn't it, that we're quite visible and present in order to sort of make sure we haven't got any issues around closed cultures. So that would be my answer to that, I think.
Okay, thanks.
Okay. Anybody else got a comment or question for Sadie? Michelle.
Yeah, thanks, Sadie. And it didn't come across scripted either, so thank you for that. And I know I agree with what Mike said, that sometimes you just need to make sure you get all the key points in. So, but it came across really, really good. And thank you. What an authentic. I think Dean's written that one, authentic presentation. It was a great way to start the board as well, because obviously we do patient stories a lot, but it's really good to hear from staff. I just wanted to say, first of all, very well done on that, and what an absolutely journey. And I think that's really good that we need to keep publicising that for the whole of the organisation. So thank you for that. And just to say about the safety huddles, we know that that they've been award winning, but it actually was picked up, that and the clinical risk group, in relationship to our recent WED-led, and we're going to come on to that. So I think there's a bit of a thread there, and I think that's really important. And Lynn's popped me in the message box about it being embedded. I suppose the most interesting thing for me that you've mentioned, the thing we're working and continue to work really hard on, and does link in with John's comment about the staff survey, is that distributed leadership piece, because we can be as visible as anything and be there all the time, but the close culture work and the patient safety is the way that we distribute that responsibility, accountability across the organisation, and it takes people like yourself, Sadie, to do that. So thank you for that. And it was really good and that resonated with me, because I think that's the real important piece for us. So thank you for that, but great way to start the board and fantastic work. Please keep it up. So interesting to hear. So thank you. Really making a difference. Thank you.
Thank you.
Thanks very much, Sadie. I can't see anybody else. Thank you for your time this morning. I'm glad you said you were at the Costa Coffee and not the Burger King close to the HQ. No, we'll pass on.
Other coffee shops are available.
Yeah, I mean, I don't know whether Michelle and the EMT are planning our own coffee shop inside the hub or what have you, but it's interesting about how you do get this match blend together. But thank you so much for your time this morning, and maybe we can hear from you again at some point in the future, and some of your team. That would be great. Thank you.
Thank you so much.
Thanks, Sadie. Great.